A 65-year-old patient presents to the emergency department with complaints of increasing dyspnea, productive cough with yellowish sputum, and wheezing. The patient has a history of smoking for 30 years. On physical examination, decreased breath sounds and prolonged expiratory phase are noted. The arterial blood gas, ABG, results show pH 7.32, PaO2 55, PCO2 65, and bicarb 28. Which intervention should the nurse prioritize for this patient? A. Administer a short-acting bronchodilator. B. Provide supplemental oxygen therapy. C. Initiate intravenous corticosteroid therapy. D. Obtain a sputum culture and sensitivity test. The correct answer is B. Provide supplemental oxygen therapy. Explanation: the patient's ABG results indicate hypoxemia, PaO2 less than 60, which is a common finding in patients with COPD exacerbation. Administering supplemental oxygen therapy will help improve oxygenation and relieve symptoms of hypoxemia, such as dyspnea and wheezing. This intervention takes priority over other options as adequate oxygenation is crucial for maintaining organ function and preventing further complications. A 55-year-old patient with a long-standing diagnosis of COPD is admitted to the hospital with increased shortness of breath, cyanosis, and peripheral edema. The patient has a smoking history of 40 years and is currently on inhaled bronchodilators and corticosteroids. The nurse notes jugular vein distention, JVD, during physical assessment. Which intervention should the nurse implement for this patient? A. Initiate continuous positive airway pressure, CPAP. B. Administer intravenous, 4, diuretics. C. Perform arterial blood gas, ABG, analysis. D. Administer oxygen via a Venturi mask. The correct answer is B. Administer intravenous, 4, diuretics. Explanation: the presence of JVD suggests right-sided heart failure, cor pulmonale, secondary to COPD. In this patient, fluid retention occurs due to increased pulmonary artery pressure, leading to peripheral edema. The most appropriate intervention is administering intravenous diuretics to reduce fluid volume overload, relieve symptoms of right-sided heart failure, and improve respiratory status. A 70-year-old patient with a history of COPD is seen in the outpatient clinic for a follow-up visit. The patient reports worsening dyspnea and an increased frequency of exacerbations. The patient's current medications include inhaled bronchodilators and corticosteroids. What is the nurse's priority action in managing this patient's care? A. Teach the patient about pursed lip breathing technique. B. Assess the patient's inhaler technique and adherence. C. Schedule pulmonary function tests, PFTs, for evaluation. D. Discuss the benefits of pulmonary rehabilitation. The correct answer is B. Assess the patient's inhaler technique and adherence. Explanation: inadequate inhaler technique and poor medication adherence are common factors contributing to the worsening of symptoms and increased frequency of exacerbations in patients with COPD. Therefore, assessing the patient's inhaler technique and adherence is the nurse's priority action. This assessment will help identify any issues or misconceptions regarding medication administration and ensure that the patient receives the maximum benefit from the prescribed therapy. A 68-year-old patient with a history of COPD presents to the emergency department with increased dyspnea and chest tightness. The patient is using accessory muscles for breathing and has a respiratory rate of 28 breaths per minute. Oxygen saturation is 88% on room air. The nurse suspects acute exacerbation of COPD. Which intervention should the nurse implement first? A. Administer a bronchodilator. B. Administer intravenous, 4, corticosteroids. C. Initiate non-invasive positive pressure ventilation, NPPV. D. Obtain a chest X-ray. The correct answer is A. Administer a bronchodilator. Explanation: the priority intervention in the management of acute exacerbation of COPD is the administration of a short-acting bronchodilator, such as albuterol. This medication helps to relieve bronchospasm and improve airflow in the airways. It is the initial step in providing immediate symptomatic relief and improving the patient's respiratory status. A 60-year-old patient with a history of COPD is admitted to the medical surgical unit for exacerbation. The patient is prescribed supplemental oxygen therapy. Which intervention is essential for the nurse to implement when administering oxygen to this patient? A. Use a high-flow oxygen delivery system. B. Keep the oxygen flow rate above 6 liters per minute. C. Monitor the patient's oxygen saturation continuously. D. Encourage the patient to remove the oxygen mask during meals. The correct answer is C. Monitor the patient's oxygen saturation continuously. Explanation: continuous monitoring of the patient's oxygen saturation is crucial when administering supplemental oxygen to a patient with COPD. Oxygen therapy should be titrated to maintain the oxygen saturation within the target range, usually between 88% and 92%, to avoid the risk of suppressing the respiratory drive and worsening ventilation perfusion V/Q mismatch. Monitoring oxygen saturation helps ensure that the patient is receiving an appropriate and safe level of oxygenation. A 70-year-old patient with severe COPD is admitted to the intensive care unit (ICU) with acute respiratory failure. The patient requires mechanical ventilation. The healthcare provider orders volume-controlled mechanical ventilation with a low tidal volume strategy. What is the rationale for using a low tidal volume strategy in this patient? A. To decrease the risk of barotrauma. B. To improve oxygenation. C. To reduce work of breathing. D. To prevent atelectasis. The correct answer is A. To decrease the risk of barotrauma. Explanation: in patients with severe COPD, using a low tidal volume strategy during mechanical ventilation is essential to decrease the risk of barotrauma, specifically pneumothorax. These patients often have increased lung compliance and are at higher risk of alveolar overdistention and subsequent lung injury. Limiting the tidal volume helps prevent excessive airway pressure and reduces the risk of barotrauma while still providing adequate ventilation. A 55-year-old patient with a history of smoking presents to the clinic with complaints of chronic cough, exertional dyspnea, and unintended weight loss. Physical examination reveals decreased breath sounds and hyperinflation of the chest. The nurse suspects emphysema. Which diagnostic test is most commonly used to confirm the diagnosis of emphysema? A. Chest X-ray. B. Pulmonary function tests, PFTs. C. Arterial blood gas, ABG, analysis. D. Computed tomography scan. The correct answer is D. Computed tomography scan. Explanation: while other diagnostic tests such as chest X-ray, PFTs, and ABG analysis may provide supportive information, the most commonly used test to confirm the diagnosis of emphysema is a high-resolution computed tomography, HRCT, scan. HRCT provides detailed images of the lung parenchyma, helping to identify characteristic findings of emphysema, such as lung hyperinflation, destruction of alveolar walls, and bullae formation. A 40-year-old patient presents to the primary care clinic with a persistent cough and production of yellowish sputum for the past 2 weeks. The patient denies any history of smoking. Physical examination reveals normal breath sounds and no signs of respiratory distress. Based on the clinical presentation, which type of bronchitis is most likely in this patient? A. Acute bronchitis. B. Chronic bronchitis. C. Allergic bronchitis. D. Infectious bronchitis. The correct answer is A. Acute bronchitis. Explanation: the clinical presentation of a persistent cough with yellowish sputum for 2 weeks, in the absence of a smoking history, is consistent with acute bronchitis. Acute bronchitis is usually caused by a viral infection and is characterized by inflammation of the bronchial tubes. It is a self-limiting condition that typically resolves within a few weeks with symptomatic treatment. A 55-year-old patient with a history of smoking presents to the healthcare provider with a chronic cough and excessive mucus production for the past 3 months. The patient also reports dyspnea on exertion. Physical examination reveals increased anteroposterior diameter of the chest, wheezing, and prolonged expiration. Which type of bronchitis is most likely in this patient? A. Acute bronchitis. B. Chronic bronchitis. C. Allergic bronchitis. D. Infectious bronchitis. The correct answer is B. Chronic bronchitis. Explanation: the patient's history of smoking, chronic cough lasting for 3 months, excessive mucus production, and dyspnea on exertion are consistent with chronic bronchitis. Chronic bronchitis is a type of chronic obstructive pulmonary disease, COPD, characterized by chronic inflammation and excessive mucus production in the bronchial tubes. It is commonly associated with a history of smoking and is diagnosed when the patient experiences cough and sputum production for at least 3 months in 2 consecutive years. The physical examination findings of wheezing, prolonged expiration, and increased anteroposterior chest diameter are typical manifestations of chronic bronchitis. A 62-year-old patient with emphysema is admitted to the hospital with worsening dyspnea. The nurse understands that which of the following is the primary underlying cause of dyspnea in patients with emphysema? A. Airway obstruction. B. Reduced lung compliance. C. Increased pulmonary vascular resistance. D. Alveolar hypoventilation. The correct answer is B. Reduced lung compliance. Explanation: in emphysema, the primary underlying cause of dyspnea is reduced lung compliance. Emphysema is characterized by the destruction of alveolar walls, leading to the loss of elastic recoil in the lung tissue. This loss of elasticity reduces the ability of the lungs to expand and contract properly during breathing, resulting in increased effort and difficulty in moving air in and out of the lungs. Reduced lung compliance is the main contributor to the sensation of dyspnea in patients with emphysema.